Now we're going to discuss some of the metabolic adaptations to chronic aerobic training. So this graph is showing you the oxygen deficit that we discussed earlier in the semester. And it compares pre-training to post-training. So after a period of training of probably a few months. So before training, you get this nice increase in oxygen consumption at the onset of exercise, and then you reach that steady state that we talked about earlier. So after training, the big difference is you get a quicker rise in oxygen consumption at the onset of exercise. So in other words, you're able to reach a steady state more rapidly. So you're reaching a steady state level more rapidly. Your VO2 increases quicker and thus hits that steady state. You're still at the same VO2 at a submaximal effort anyway, but you're just able to get to that VO2 a little bit quicker. So what that does in essence is decreases the oxygen deficit. And this is just believed to be due to a better ability to use oxidative metabolism at the onset of exercise. Other metabolic adaptations, a pretty big adaptation is that you're better able to utilize fat as an energy substrate. So if you look at these graphs, you see that if someone were to exercise for 2 hours, the amount of energy that they're expending pre and post training is pretty similar. So up to about 1,000 calories. But where that energy is coming from is slightly different. So you can see after training, more of that energy is being derived from fat as opposed to carbohydrate. So the key point is that aerobic training leads to a more effective utilization of fat as an energy substrate, and that allows you to spare some carbohydrate. So why would that be? There's several things that change and adaptations that your body makes that lead to better utilization of fat after exercise training. So the first two have to do with blood flow and oxygen utilization. So increased capillaries would allow you to transport more oxygen to the muscle. Also increased mitochondrial capacity, like we talked about. More mitochondria allows you to use more oxygen, thus you could theoretically utilize more fat. Increased fat metabolizing enzymes, such as those enzymes in the beta oxidation pathway. Then also you're better able to transport fat into the muscle with that fatty acid binding protein that we talked about. So as far as lactate goes in chronic exercise training, so lactate production, if we just remember where lactate comes from, at the end of glycolysis, pyruvate combines with NADH, forming lactate and NAD. So we say pyruvate is being reduced to lactate. So after endurance training or aerobic training, you tend to get a reduction in lactate production, at least at a given workload. So why would that be? Well, we just had this discussion of carbohydrate versus fat metabolism. So if you're better able to use fat after training, that is naturally going to lead to less lactate, because we know lactate production comes from carbohydrate metabolism. Also, improvement in the shuttle systems. What I mean by that is, remember this NADH, this is out in the cytoplasm. So for NADH, for lactate to form, NADH has to react with pyruvate. But remember, there were those two shuttle systems, malate aspartate and glycerol phosphate, that move this NADH into the mitochondria so it could be used in electron transport. So if those shuttle systems improve, you get more of this NADH moved into the mitochondria, less is able to react with pyruvate to form lactate. So thus that would lead to less lactate production also. And then one final thing, there's different forms of the enzyme lactate dehydrogenase, and these are the forms. You really don't need to know these other than the extremes. So M4 is at one extreme, H4 is at the other extreme. These are just different, what we call isoforms of the lactate dehydrogenase enzyme. So with aerobic training, we get a shift towards this H4, and the H4 has less of ability to produce lactate compared to the M4. So just by kind of switching the enzyme a little bit and altering the enzyme lactate dehydrogenase, it's less likely to produce lactate. So it doesn't produce as much. So bottom line is there's less lactate production at a given workload after training. So, and this is just to remind you of where those NADHs were coming from. So the NADHs can either hang out in the cytoplasm and convert pyruvate to lactate, or they can be shuttled into the mitochondria. And so that was going back with improvement in those shuttle systems could theoretically lead to a lower lactate production. As far as lactate removal or clearance, so we're better able to remove lactate after aerobic training. And a couple of reasons: improved blood flow to the liver. So the liver is a site where a lot of lactate goes to go through the Cori cycle. So that improves. And then also lactate shuttles. We had a brief discussion of this. Some lactate is actually shuttled into muscle fibers. And so even though the lactate is produced in muscle fibers, oftentimes it's shuttled back into muscle fibers. So those lactate shuttles doing that tend to improve with aerobic training, which basically leads to more lactate oxidation by skeletal muscle. So if you're better able to use lactate as a fuel source, then that's going to lead to improved lactate clearance. So with what we discussed with the production versus the clearance, the lactate threshold is going to shift towards the right. So we call that an increase in the lactate threshold when it shifts to the right. So in other words, less production, more clearance is going to lead to the person being able to work to a higher intensity before lactate starts to accumulate. Thus, the lactate threshold will shift to the right. So you'll see something like this. Before training, lactate threshold may occur here. After training, out here. So it occurs at a higher intensity. So respiratory adaptations to aerobic training, there's a few that's it's not near as pronounced as the cardiovascular adaptations, but tidal volume at rest tends to increase, and also at maximal exercise it will increase. So increase for tidal volume. Breathing frequency or breathing rate. Resting breathing rate tends to come down. So resting breathing frequency will be a little bit lower. Maximal breathing frequency during maximal exercise will actually be higher. So with that, if we look at pulmonary ventilation, at rest, there may be no change because breathing frequency went down, tidal volume went up, so no real change here. Maximal exercise, both of these are going up. Max tidal volume, maximal breathing frequency, though, so maximal pulmonary ventilation tends to increase. Ventilatory threshold, which we've discussed, it's very similar to the lactate threshold, so it's going to shift to the right, just like the lactate threshold did. In general, for hormonal changes, there's an attenuated response of hormones to exercise after training. So after training at rest, you may not see any major differences in resting hormone levels, but how those hormones respond to stress may be a little bit different. So in general, there's less of an increase or less of a decrease if that hormone goes down during exercise. For example, for catecholamines that we know go up during exercise, they won't go up near as much at the same exercise workload because that exercise workload represents less of a stress on the body. Insulin, which we know goes down during exercise, there'll be less of a decrease. So that's what we mean by attenuated response. The hormones won't respond as much as they did before training. As far as muscular adaptations to aerobic training, so type 1 fibers are where you'll see a lot of the adaptations because those are the aerobic fibers. They may actually get a little bit smaller due strictly to aerobic training, which is thought to help with gas diffusion into the muscle. But that may be relatively small in the grand scheme of things. As far as type 2 fibers, you wouldn't expect to see massive changes because those are more of your anaerobic fibers. As far as shifting fiber types, there's a lot of debate on whether you can, with exercise training, is enough of a stimulus to shift a fast twitch fiber to a slow twitch fiber. Definitely, you can kind of go between the different subtypes within each category. So maybe from a 2X to a 2A, which would basically mean your very anaerobic fibers become more aerobic in nature, but they're still classified as a fast twitch fiber. As far as switching all the way to type 1, there's not a consensus that this happens due to exercise training, but there are scientists that do debate this on some level. So it's kind of a gray area. So the general consensus is you don't get a full switch from 2 to 1. So you do get switches between the different forms of type 2 potentially. As far as 2 all the way to 1, not really. At least there's not conclusive evidence that this occurs in response to exercise. All right, so moving on to anaerobic training. So if we're talking about sprint training, like the adaptations that a 100-meter sprinter might have or a 200-meter sprinter, the adaptations they're going to get in the muscle are going to be mainly in the type 2 fibers. And they may, a couple other things, high pain tolerance, improved buffering capacity, better able to handle those hydrogen ions. So these are some, what I would consider excess adaptations. I think the main adaptations that they're going to get are going to be shown in this figure. So, and a lot of this is kind of common sense when you think about it. If someone is training the anaerobic pathways, so either the immediate pathway or the glycolytic pathway, you're going to see improvements in those pathways. And this is just the principle of specificity that we talked about. So anaerobic enzymes, like all those enzymes of the immediate pathway or the glycolytic pathway, they're going to improve. Creatine phosphate levels will go up because that's in the immediate pathway. ATP storage, since you need a lot of it quick, will go up. Glycolytic capacity up, and then overall glycogen content, since we can use glycogen anaerobically, that will increase. So by training anaerobically, your anaerobic systems will improve. And so another type of anaerobic training, which is a little bit different, is just resistance training or weightlifting. So as far as resistance training goes, we'll start by saying that chronic weightlifting or resistance training leads to improvements in muscular strength, endurance, and size. So I wanted to quickly define those words. So muscular strength can be defined as the maximal force that a muscle or muscle group can produce. And we can think about muscular strength in a couple of ways. We can measure it dynamically, which is commonly done in weightlifting. So like if you were doing a bench press and seeing how much weight you could lift, that would be dynamic where there's actually movement. Or you could do static or isometric strength also, if you had some type of dynamometer to measure isometric strength. So dynamically, the gold standard for assessing muscular strength is going to be called a 1 repetition maximum, or 1 RM, which is how much weight you can lift one time in a given exercise. For static strength, like if you had a dynamometer like the Biodex or something, you would get a certain force output during an isometric contraction. We generally call that the maximum voluntary contraction, or MVC. So 1 RM is a more dynamic measure. MVC is a static measure of muscular strength. As far as muscular endurance, the way to define muscular endurance is a little more difficult, but it's basically the ability to make repeated contractions without fatigue. So again, there's dynamic and isometric or static. So dynamic muscular endurance would be commonly measured by how many repetitions you can do with a given weight without fatiguing. So once you can no longer do another repetition, then that would be the measure of muscular endurance. So the way it's commonly measured is to see how many repetitions you can do of a given exercise. So something as simple as a push-up test, where you see how many push-ups you can do. And let's say you can do 20 push-ups. That repetition number, 20, is how many you could do before fatiguing. That would be your measure of muscular endurance. As far as static measures of muscular endurance, it's more of a time issue, how long you can maintain a given contraction before you start to lose force production. So, in other words, if you were to try to hang on a pull-up bar with your elbows bent for a period of time and see how many seconds you can hold that position before your arms start to extend. And so that would be a static measure of muscular endurance. So now that we have those things defined and we've talked about ways to measure them, before we get into the actual muscular changes, I wanted to bring up there are some cardiovascular changes that occur with resistance training. And we've already discussed one of these. So with aerobic training, we saw the eccentric cardiac hypertrophy. That was the increase in chamber size. But remember the shot putters and wrestlers that we showed in that figure early on? They were getting more of an increase in wall thickness and left ventricular mass. So we call that increase in wall thickness concentric cardiac hypertrophy. So classically, weightlifting has thought to result in more of a concentric cardiac hypertrophy, which is an increase in the left ventricular wall thickness. And as opposed to the aerobic training, which leads to chronic volume overload on the heart, leading to this eccentric hypertrophy, weightlifting puts a chronic pressure overload on the heart. So every time you lift weights, your blood pressure is going to go up. That's going to put some pressure on the heart. The way it adapts is more of an increase in wall thickness, an increase in mass. So that's why you see these kind of distinct changes. I put this number here. This is kind of an extreme example, but this is actually a recorded blood pressure during heavy weightlifting. So 480 over 350. So assuming that resting blood pressure is normally around 120 over 80, you can see how drastic of a change this is. But in people who are used to doing this, heavy weightlifting, this is considered somewhat normal, and it's not thought to be overly risky, even though these numbers look kind of scary because they're so high. The other cardiovascular adaptation that I do not have listed here, but it's important, has to do with the blood vessels. So with chronic resistance training, the blood vessels become more stiff or less compliant. Compliant is kind of the key word to describe this. So whereas aerobic training leads to an increase in compliance of the blood vessels, meaning they kind of stretch out a little bit more, resistance training leads to less compliance, so the blood vessels become a little bit more stiff. So I think of this as kind of like a protective mechanism. If you are constantly putting the cardiovascular system under these high pressures, the heart adapts like we said, and your blood vessels also need to adapt. So how do they adapt? They get a little bit stiffer and stronger, so they're better able to handle this increased pressure. Okay, so as far as improvements in strength, I think it's a given that with weightlifting, chronically we will get stronger. There's a couple of strategies that your body uses to increase muscular strength. We have neural adaptations, and then we have adaptations that occur within the muscle. So, and for the neural adaptations, we have motor unit recruitment. You're better able to recruit more motor units. And if you recruit more motor units, you're going to recruit more muscle fibers, which will lead to an increase in strength. And going along with that, these motor units are better synchronized. So by improving what we call motor unit synchronization, the motor units are working together a little more closely in a more synchronized fashion, and that's going to help improve muscular strength. And then we talked about the Golgi tendon organ earlier, and you can desensitize the Golgi tendon organ and somewhat inhibit it, and that is going to increase muscular strength also. So desensitization of the Golgi tendon organ will also lead to improvements in muscular strength. And then the other main strategy is the muscles just get bigger. There's more protein in there, more actin, myosin, and thus that's gonna the muscle's gonna get bigger, and that's gonna lead to improvements in strength. So both type 1 and type 2 fibers will hypertrophy due to resistance training, although you would expect normally more of the change to be in the type 2 fibers. So an interesting concept as far as how the muscles get bigger. When we think of an entire muscle getting bigger. There's two kind of ways that that could happen. And these are not muscle cells shown in this picture, but I like this picture just because it gets the point across. So if we think of from here to here, the width of this picture to be the size of the muscle. So we see before training, if we say this is before training, the muscle is this big. Then after resistance training, the muscle gets this big, the width of the all the way across the picture. So we could definitely say that after training, the size of the muscle improved. So the question is, how did it improve? Did we, before training, we had 4 muscle cells in this case anyway. After training, we still have 4 muscle cells, but in this case, they just got bigger, and that led to an increase in muscle size. The other option would be this that you see at the bottom. So we started with 4 muscle cells, now we have 6, but they stayed the same size, so the muscle fibers stayed the same size, but they just increased in number. So if this first option happened, we just call that muscle fiber hypertrophy. So if each muscle fiber just gets bigger, that increases the size of the muscle. We call that fiber hypertrophy. If the muscle fibers stay the same size but actually increase in number, we call that fiber hyperplasia. So that's a question that a lot of people ask, is what causes muscles to get bigger? Do the muscle fibers themselves get bigger, or do they just increase in number? So in humans, the consensus is the hypertrophy happens. So in humans, there's not a lot of evidence that you can actually increase the number of muscle fibers with resistance training. But what definitely happens is the muscle fibers themselves get bigger, and we call that fiber hypertrophy. There's not a lot of evidence in humans that fiber hyperplasia can take place. Interestingly enough, in some animals, birds, rabbits, maybe a few other species, they have shown hyperplasia in muscle, which makes this a little more confusing. But as of the moment, the consensus is fiber hypertrophy is the reason that your muscle fibers are getting bigger. So that would be the answer as far as what's causing muscles to get bigger. So as far as the mechanism by which resistance training increases muscle size or fiber hypertrophy, it's a complex pathway. But the bottom line is there's more protein synthesis. So the complex signaling pathway that this picture is showing, this is one of the key pathways that is thought to lead to an increase in muscle fiber size. And it's commonly just known as the mTOR pathway, because this molecule mTOR is key at regulating the protein synthesis. So you can see how complex this actually gets with all these signaling molecules, but the bottom line is this mTOR pathway leads to improved protein synthesis, which is going to lead to improved or increased muscle hypertrophy. These other cells called satellite cells also play a role. So these cells are located in the periphery of a skeletal muscle fiber. So out here on the edge, so periphery. These are kind of like stem cells. They replicate rapidly. So due to resistance training, there's muscle damage, and that stimulates these satellite cells to start replicating. So the satellite cells start reproducing. And you can see that going on here. So muscle fiber, then there's damage, maybe due to weightlifting, and then those satellite cells start replicating. What they do is I'll tell you what they do not do first. They do not become muscle fibers. So if they did, that would be significant muscle hyperplasia. So a lot of people initially thought that each satellite cell would become a new muscle fiber and you get hyperplasia, but that's not the case. So what the satellite cells do is they provide additional nuclei on the muscle fiber to support protein synthesis. So if you remember from a biology class maybe where you learned about protein synthesis, for protein synthesis to occur, you have to make a copy of the DNA, and that copy is known as messenger RNA. And then that messenger RNA is translated outside the nucleus into making new proteins. So key point of that is that the DNA is necessary to instruct protein synthesis, and the DNA is located in the nucleus. So these satellite cells are basically acting as additional nuclei to help drive and provide instructions for this elevated protein synthesis. And this is a classic graph kind of showing you the interrelationships between neural adaptations and muscular enlargement or hypertrophy adaptations. So as you go from sitting on the couch watching TV in an untrained state to now you're going to the gym lifting weights, you can see this red line represents an improvement in muscular strength. So muscular strength goes up, then it plateaus at some point, and then obviously they could take anabolic steroids to get even stronger. But let's say muscular strength increases in response to resistance training. So as far as what causes the improvements in strength, you can see the role of neural and hypertrophic changes. So initial increases in muscular strength with resistance training are due to neural adaptations. Then it takes a little bit longer for these improvements in hypertrophy to occur. So as a time course, neural changes happen first, followed by increases in muscle size or hypertrophy. And here's another graph kind of showing the same thing in a different way. As far as resistance training, here's training duration and percent improvement or contribution to improvements in strength. Neural adaptations are mostly responsible during the initial phases or initial weeks of resistance training, and then those kind of taper off, and then the hypertrophic changes take over. All right, so here's some a list kind of some of the adaptations that you would get with chronic resistance training. So a lot of these we've talked about. A couple of these will be new, but for the most part, they should kind of add together. So as far as resistance training, number of muscle fibers equivocal. So we said no evidence for hyperplasia, or not conclusive evidence anyway. Size is going to increase. So that's the hypertrophy we talked about. Type unknown. Again, there's not a lot of evidence that you can, conclusive evidence anyway, that you can shift from fast twitch to slow twitch and vice versa. As far as strength, will definitely go up. Mitochondria, I want to focus on the mitochondrial density here, not necessarily the volume. So density is mitochondria relative to the muscle size. So just even if mitochondria stayed the same within the muscle, like we didn't get a massive loss of mitochondria, the density would still decrease just because of the increase in muscle size. And so I think that's the important point. So mitochondrial density generally goes down just due to the fact that the muscle is getting bigger. Enzymes, these two are enzymes of the immediate pathway. Since we definitely use the immediate pathway during weightlifting, those are going to improve. Glycolysis, PFK, will increase because it's primarily an anaerobic enzyme. Lactate dehydrogenase, for whatever reason, no change. As far as aerobic metabolism, carbohydrate metabolism enzymes, so maybe those in glycolysis also could increase. And again, we can use carbohydrate anaerobically, even though it's listed as an aerobic metabolism. The other factor to consider is during recovery between sets of resistance training, you are going to use oxidative metabolism, so we can assume a lot of that energy to kind of replenish creatine phosphate is coming from carbohydrate metabolism aerobically. As far as fat metabolism, nothing major, as you would expect. Fuel sources, ATP is going to go up, which was great, just like we saw in the sprinters. Creatine phosphate will increase, as we would expect. Glycogen can increase. So these are very similar to what we saw with the sprint training. And again, immediate pathway utilized here, immediate pathway utilized in the sprinters. Triglycerides, no real change, as you would expect. VO2 max, no change with classic resistance training because VO2 max is an aerobic measure. It measures aerobic capacity. But if you were to do resistance training with an aerobic component like circuit resistance training, where you're moving from machine to machine relatively quickly, then I think that would be more of that would lead to small but significant increases in VO2 max. They say about 5 to 6% increase. And as far as connective tissue, you see some improvements there with the ligament and tendon strength. So one last consideration. A lot of people do both aerobic and resistance training, which is good. Both are recommended by the American College of Sports Medicine. And so the question becomes, will one interfere with the other? And when you're doing both aerobic and resistance training, it's commonly referred to as concurrent training. And so a lot of people are worried if they do both, it will limit their improvements in the other. So there's been a fair amount of research on this, and there's still a lot of unknown areas about this, because due to the longitudinal aspect of concurrent training, it's really hard to see what's going to happen after years of doing this in a research study anyway. So what we do know at this point is strength training by itself does not seem to limit any aerobic gains that you might get. So if you're a runner or a cyclist, weightlifting seems to be a good strategy to kind of add in other forms of activity, and you won't expect it to negatively improve your performance. As far as aerobic influencing resistance training, so there is a little bit of evidence that some of your strength gains could be attenuated or minimized by doing excessive aerobic activity. But there is some debate about this also. It really depends on how much you're actually doing, and modality is important also. For instance, there's some evidence that if you were to do cycling as opposed to running, your strength gains may not be limited as much. But you have to think of the kind of case-by-case basis. How much are you actually doing of each? And then what your goals are. If you're a professional weightlifter, yeah, you may want to be overly concerned about how much aerobic activity you're doing. But if you're just out there to do aerobic training and resistance training to stay fit, I think you have to kind of take that for what it is, and it isn't really that big of a deal if some of your strength gains are minimized, because you're getting all these other benefits from doing the aerobic activity.